Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration.
Hi, my name is Harvey Shiffman. I'm a general dentist from Boynton Beach, Florida. For the last 16 years, we've been involved with laser dentistry, applying lasers to all phases of dental practice. What we're going to be discussing today is the use of lasers in dental sleep medicine, and primarily the Nightlase procedure. Nightlase, all of our patients should be screened medical legally. We need to document their pre-existing conditions, make sure that if necessary they're referred out to a sleep specialist to have an evaluation, a sleep study done, so we can get a true diagnosis as to what their condition is. Just like traditional sleep dentistry, we follow up with sleep studies, and very important to document all this in our records. Nightlase is a non-ablative laser procedure. We're using two different wavelengths of laser, and we're getting a tightening of the soft palate, the uvula, and the surrounding tissues, which actually opens up the airway. Nightlase doesn't require any anesthetic, not even topical in most cases, and there's little to no post-op discomfort. During the procedure, the patient feels a warm towards hot sensation, like they're taking sips out of a hot cup of coffee. The typical patient will need 3 20-minute treatments, and they're spaced out every 21 days. Some patients will need more based on their condition, and our training evaluates how many treatments are needed. The majority of patients will see some reduction in the volume and tone of snoring after their first treatment. Nightlase was developed in South America. It was developed actually by a group of gynecologists that were using the laser to treat urinary incontinence and to do vaginal rejuvenation. And the similar tissues that are found in the throat reacted very well to the same wavelengths of laser. Nightlase is an evergreen procedure, just like our hygiene department. So we actually have our patients on a recare every 6 months to a year based on the severity of their condition when they come back for retreatments. All right, so the laser modality that we use to actuate the collagen conversion is something called smooth mode. Smooth mode is a proprietary pulse modality of the erbium YAG laser that's found in the Fotona Lightwalker laser, which gives a burst of pulses into the soft tissue. This burst of pulses is what's called longer than the thermal relaxation time, which means that heat builds up in the tissue. Very different than when we use lasers on bone or teeth, where we want those pulses to be shorter than the thermal relaxation time, so we don't get a buildup of heat. So what we get is a gentle heating deep into the tissue, which causes collagen remodeling and stimulates neocollagenesis, or the formation of new collagen. So I equate this to taking a hammer and a nail and tapping the nail into a piece of wood. Every time the laser pulses, it's pushing the heat deeper into the tissue. And that's the smooth mode modality of the Fotona Lightwalker laser. There are 3 mechanisms of action of the Nightlase protocol. The first one's photothermal interaction, where the laser actually pumps heat into the tissue. The second is the thermomechanical interaction, where you get a contraction of the tissue up to 30%. And the third is the formation of new collagen fibers. Histologically, we see on the right-hand side the density of the collagen in the tissue after Nightlase therapy. So a very important question that we ask all of our TMD, facial pain, and sleep patients. What percentage of improvement do you consider a success? Because we want them to have a realistic expectation as to what the results are going to be with the therapy. Comparing mandibular advancement devices and CPAP, mandibular advancement devices get up to about a 50% improvement in AHI, or apnea-hypopnea index, and snoring. CPAP up to 75%. Now, this is under optimal conditions with 100% compliance. Now, we know that most of our patients are not 100% compliant. With Nightlase therapy, our patients are 100% compliant. They just need to come back for their periodic touch-ups, because there is no appliance, there is no device for them to wear. So they get 24-hour-a-day better breathing and better nasal breathing also, which is very important. So a little fact, about 67% of people snore, and about 80% of those patients have some type of sleep apnea or sleep disordered breathing. Nightlase, like we mentioned earlier, is thermally mediated. We're pumping heat into the tissue and converting and remodeling collagen to more elastic, more resistant forms of collagen. So these improvements in the collagen is what prevents the collapsibility of the upper airway, and that's very important. And that's been shown through research. Clinically, we see that our patients' nasal breathing is significantly improved 24 hours a day. So they get benefits not just when they're wearing an appliance or using a device. As an offshoot of Nightlase, because of that intense improvement in nasal breathing, we're developing a protocol called Performlase, which is for cardio-intensive athletics to enable our patients to breathe better during their athletic performance and improve athletic performance. And we're currently in treadmill testing on this protocol. This slide shows before and after, all the befores on the left, afters on the right. Sirona SciCat Air software, where we evaluate the airway before and after. This particular patient had almost 100% increase in airway volume after Nightlase therapy. Now, the airway volume is only one indicator. We also combine that with sleep studies to make sure that the patient is getting healthier, which is our end goal. Very important to document the Mallampati Classification. We use a very specific positioning technique for that to get repeatable results, which are very, very important. The area of treatment, you can see on the red in this slide, soft palate, the uvula, the anterior tonsillar pillars. Those are purely within the scope of practice of dentistry in any state in the United States and Canada. So the contraction of these tissues brings the soft palate superiorly and anteriorly. So you'll see a slight wrinkling of the soft palate after the treatment is being done, but that opens the airway and reduces the collapsibility. Very important for all our doctors and patients and our dental team to wear wavelength appropriate laser eyewear to protect their eyes while the therapy is being done. This is the erbium handpiece for the Lightwalker laser. It's a proprietary handpiece. It's got a fractal screen in it, which means the beam is broken up into about 40 little mini beams. And this is what the fractal beam looks like. We do not look into the beam when the laser is being actuated. Very important. And this is positioning so you can see what it looks like intraorally when the treatment is being done. Co-therapy is very important. A lot of our patients come from other practices where they're either using a CPAP or they're wearing a mandibular advancement device, but they haven't been able to get to a healthy AHI number. So they're just not healthy enough yet. By combining co-therapy with Nightlase and the appliances or the CPAP, we're able to get them healthier with less air pressure with the CPAP and also less titration of the mandibular advancement device anteriorly, which minimizes TMD issues and occlusal changes. So co-therapy is very, very important. And we never tell the patients that we're going to eliminate their previous devices. Sometimes we can, sometimes we can't, but it's on a case-by-case basis. So we found through 10 years of dental sleep practice that not every patient responds to every treatment modality. Nightlase is another tool in our toolbox to help our patients get healthy and help manage their dental sleep disorders, medical sleep disorders. This is a case study where you can see the soft palate and the uvula has come up and slightly forward, and you can see the wrinkle across the soft palate on the right-hand side there. Another case study, even more significant results. So Nightlase, like I mentioned before, is another tool in our dental sleep medicine toolbox. It gives us the ability to help our patients be healthier. We see a lot of patients in our practice that have failed CPAP use or they've failed the use of mandibular advancement devices. So these patients, up until the use of Nightlase in 2010, have not had any other treatment opportunities. So that a lot of them have gone without treatment. A lot of these patients have their CPAP machines in a closet, in a basement, or an attic. Same thing with their mandibular advancement devices. So we see a lot of patients, again, that have failed in their previous treatment. And Nightlase with the Fotona Lightworker laser enables us to give them another option for health. If you have any other questions or you'd like more information about what we've discussed, my contact information will be following. Thank you.